Hello, we are case 4, and we will be presenting our case today regarding some key factors, which are COVID-19, atrial fibrillation, commonly known as AFib, as well as the effects of dehydration. The group members in this case are Dustin Martin, Cole Ortiz, Hannah Irby, Katie Hutra, Sam Ramirez, and myself, Yamaya Mitchell. So just to introduce our case a little bit, our patient is Mrs. Carter. She's 78 years old. She's obese. She has AFib. She also has a diagnosis of COVID and a past medical history of type 2 diabetes, hypertension, peripheral artery disease, and a past surgery that was a CABG. So what are some contributing factors that made Mrs. Carter a fall risk? Because Mrs. Carter was referred to physical therapy because of her most recent fall. So some of those factors are the effects on the ineffective oxygen transport. So she did come to the hospital severely dehydrated, and that can have some effects on orthostatic hypotension, because of the reduction in blood volume that can lead to reduced perfusion of oxygen to the brain and the overall body as well. And that can result in syncope, which is just a loss of unconsciousness. Some other factors that made Mrs. Carter a fall risk or could have possibly caused her fall is her AFib, her diagnosis of AFib, and her age as well. So what is AFib? AFib is a cardiac arrhythmia commonly characterized by ineffective atrial contraction and usually with characteristics of rapid and disorganized contractions, typically leading to an overall decrease in cardiac output. So to the right here, I have a picture of just a normal heart being compared to a heart that is showing characteristics of atrial fibrillation. So as you can see with the normal heart EKG, it is a very smooth rhythm, and you can clearly see each wave, such as the PR wave, the Q wave, and the ST wave. They're very clearly defined. But when you look to the right, with the atrial fibrillation, you see that the waves are not so defined. You can't really see the PR interval as well, and you see more of a quivering effect on the heart rate. And I also wanted to point out that in the atrial fibrillation, you do see the irregular electrical impulses and the slight enlargement of the heart, specifically the atrium, and the pooling of the blood that you see in the atrium, which I will talk about a little bit later. Well, right now, so the pathophysiology of AFib and COVID-19. So for the pathophysiology of AFib, the common characteristics that are seen are altered electrical signals. So when a patient has AFib, there will be abnormal electrical signals that often originate from the ectopic foci that are found in the pulmonary veins, and they tend to fire very fast, very rapidly, which can cause very chaotic and uncoordinated contractions of the atrium. You will also see some atrial remodeling. So the myocytes in the atrium are typically very stretched and can contribute to fibrotic tissue in the atrium. And these structural changes that you can see can disrupt the electrical conduction and are commonly seen in patients with hypertension, which Mrs. Carter does have. And you can commonly see this with patients that have heart failure. Another factor that I would like to mention with the atrial fib pathophysiology is the atrial inflammation and the oxidative stress. It's also a common structural change with AFib and can also lead to that remodeling of the atrium. You will also see decreased or loss of atrial contraction, which can cause ineffective contractions of the atrium, and ineffective atrial depolarization that can lead to pooling of the blood in the atrium, causing decreased perfusion of oxygen to the body and the brain. And due to that, we also will see that syncope, which is also tying back into that increased fall risk that Mrs. Carter is. So for the pathophysiology of COVID, you'll see that the you'll see inflammation of the body that can affect the heart, leading to arrhythmias such as AFib. And also, when you see the presence of AFib and COVID-19 together, you'll typically see prolonged heart issues as well as strokes. And I also just wanted to put that picture there down to the right, just to reiterate the differences of the normal heart and the atrial fibrillation heart contractions, which are very different due to those rapid firing impulses that are causing those ineffective contractions of the atrium. So some risk factors for AFib and COVID-19. So for the AFib risk factors, you of course can see blood clots, which are a significant thing to watch out for as PTs. Because it can lead to pulmonary embolisms, which are very severe and can cause death. Another risk factor is family history, high blood pressure, obesity, and thyroid disease. And again, we see a lot of these risk factors in our patient, Mrs. Carter. So you see that the effects of AFib does play a major factor. So for the COVID risk factors, age is a big risk factor, especially over the age of 65, and being in the hospital, a weakened immune system, as well as any underlying medical issues such as heart disease can increase the risk factors for AFib and COVID-19. So for PT interventions for AFib and COVID-19, for AFib, you do want to monitor the heart rate and all vitals very carefully. You want to make sure that the heart rate doesn't increase significantly throughout the PT session, as well as just watch all of the vitals to be sure that we are not veering from baseline too much. You also want to monitor for exercise intolerance, which could be dizziness, palpitations, or exercise fatigue. Exercise should be at a moderate intensity and gradually increase with an adequate warm-up and cool down to avoid cardiac stress. For COVID, you want to monitor the vitals again very closely. Of course, the O2 saturation, you want to be sure that we are not desatting during the PT session. And again, you want to monitor the heart rate to make sure that we are not increasing or decreasing too much. Respiratory support is also important for patients with COVID-19 because you do see very significant effects on the respiratory system. So incorporating breathing exercises could be very beneficial for these patients. And you also want to gradually progress the intensity of the exercise. And a big one that we want to make sure that we are following is the infection control, especially for patients with COVID, as Mrs. Carter does have, and MRSA.